Hi everyone. So let's go ahead and take a look at section 4 of chapter 19. And what section 4 is going to cover is coronary vessels or coronary circulation. Coronary circulation is going to be how the blood is going to be delivered to the heart wall. So remember where we left off last time in section 3 was looking at this great demand of energy for the heart because of the fact that it is, of course, cardiac muscle that's continuously contracting, or we hope it's continuously contracting, right? That's what we want it to do. So in order to meet that great energy demand, the blood vessels are going to deliver the oxygen and then, of course, gather the deoxygenated blood and bring it back to the heart. So let's go ahead and take a look at this coronary circulation. So just taking a look first at the different components of the coronary circulation, you have coronary arteries and coronary veins. Coronary arteries are going to be the ones that transport oxygenated blood to the heart wall. So once it's delivered the oxygen, and also it can deliver nutrients, whatever else it needs, the coronary veins are going to pick up that deoxygenated blood, or actually the deoxygenated blood is going to drain into the coronary veins, and then that is going to bring it right back to the right atrium. So let's first take a look at the coronary arteries. So if we take a look at where the coronary arteries are going to be located, or where they start, where they begin, they actually branch off of this ascending aorta. There's a couple of reasons why. Of course, if we think about the side of the heart, it's going to be the left side of the heart, and that's where the oxygenated blood is. That's exactly where we want it. We don't want to stick it on the superior vena cava and have deoxygenated blood that's going right here. It's a nice little close proximity to where it's going to need to come off of. And then think about the amount of pressure that is going to build up on that left side of the heart. We talked about it a little bit in an earlier section about how the left side of the heart needs to generate enough pressure to get blood to the rest of the body, to the tippy toes, to the hands, to all of the body tissue. So because of that, there's enough pressure for it to push blood through this right and left coronary artery. So it makes sense, right? And of course, you see that the right side is going to have these kind of branches that are coming off of it, and you don't have to worry about the different branches for lecture. You do have to know them for lab, and you don't have to worry about what branches supply what part of the heart either. But it's just kind of interesting to note and to look at the different coronary vessels. Let's take a look at the left side of the heart, and then we're going to come back to this website that I want to show you guys here in a second. So the left side of the heart, here is one vessel that we are going to take a look at a little bit more. So if you had to know one of the coronary arteries for lecture, it would be this anterior interventricular artery. Another term that you'll see used around, especially this website that I'm going to show you, is the left anterior descending artery. That's another term that can be used. But this is going to be this big giant artery that's going to supply a lot of the left side of the heart, and the interventricular septum as well. So that's why it's known as the widowmaker, because if you have an occlusion in this artery, then you have a higher risk of fatality. So that's why it's known as the widowmaker. And it happens to be one of the most commonly occluded vessels as well, coronary arteries as well. The left coronary artery is a little bit shorter. I guess not really shorter, I don't want to say. Well, I guess it is. If you take a look at it, here's the left, the right kind of curves around a little bit. The left splits off pretty early, and sometimes you can't even see the left because it's covered with the auricle, and of course, as you can see, the great vessel as well. If we take a look at the blood flow through these coronary arteries, it's actually going to be intermittent. Whenever the heart is relaxed, the vessels are open or patent. Remember I mentioned this word before. So that's whenever blood is actually flowing through the vessels and getting to where they need to go. But whenever the heart contracts, it actually goes and pushes on those arteries and closes them off and compresses them. So it interrupts blood flow at that point. So you kind of had this intermittent movement of blood going through as the heart muscle contracts and relaxes. Let's take a look at the coronary veins. These are a lot easier because you have a small, you have a middle, you have a great cardiac vein. They're basically all just gathering that deoxygenated blood, and they will eventually all of these are going to eventually drain into the coronary sinus. This is one that I had mentioned with blood flow in an earlier section. But the coronary sinus is going to be on that posterior part of the heart, as you can see right here. And all of those vessels are going to drain the blood in there, and then eventually that coronary sinus is going to go into and drain the deoxygenated blood into that right atrium. So it's a pretty smart thing to do there, right? To put it right back in the right atrium so it can go through circulation and pick up some more oxygen. Yeah. So let's go to this website right here. So I'll post this on eCampus, but it's a way to kind of help you if you're having difficulty with the APR and knowing what structures are what. So you can kind of go over here and click on different structures: the right atrium, the right ventricle, pulmonary artery. Some books will call pulmonary artery, pulmonary trunk the same exact structure, so just be aware of that. But let's take a look at the coronary arteries and what it has. The one I told you that if you had to know for lecture was this one. So if we click on it, it's going to bring up which one is the left anterior descending artery, that big giant one that's right there. If we go to the cardiac veins or the coronary veins, let's take a look at that coronary sinus. It even tells you the importance of delivery and things like that. Coronary sinus, it flips into the back, shows you where it's going to be. So it's kind of interesting website here, especially if you're going into the cardiac field, and it kind of goes through a little bit more coronary system tutorials and things like that. So you might want to gather that information or just look it over. So let's talk about something that happens if these coronary arteries are occluded, and this is called coronary artery disease. So you'll actually be taking a look at a TED Ed video. I'm sure TED is much more exciting than the Rebecca Ed video that you guys watch. Cool animations and things like that. But the TED Ed video is going to kind of go through and look at a myocardial infarction and talk about what happens with, when blood vessels are occluded. Just make sure you know that coronary artery disease is going to be where there's a plaque buildup on the walls from atherosclerosis, and he talks about the narrowing. I think one thing that he doesn't talk about is the pain that can be felt on the left side of the chest or arm. It's called angina pectoris. It's a referred pain, meaning that, when you feel it on the left arm or the jaw, that's not where the actual pain is coming from or the problem's coming from. So that's that referred pain. That will be covered in 2401. But angina pectoris usually results whenever an individual is undergoing strenuous activity. That means that there's a greater demand for energy and a greater demand for blood, and if coronary blood. And if your coronary arteries are occluded, then it's not getting the oxygen that it needs. So it's a kind of a way to tell the patient that you're not getting enough blood to your heart. Usually what happens is the individual needs to stop the strenuous activity, and then the pain will go away, or they can take like nitroglycerin tablets as well. And the video will also talk about the myocardial infarction and talk about ways to help with coronary artery disease, getting rid of the plaque, and also take a look at bypass. So I hope you guys enjoy that video, and until next time.